Hi everybody, my name is Jana Santos and I'm a first semester CNO student, and today I'll be doing my validation number 3, okay? Thank you. Let's begin. Hi, Mr. Santos.
Hello.
Hi, my name is Jana Santos. I'll be your nurse for today. I'm gonna wash my hands very quickly. So how are you this morning?
I'm pretty good, thank you.
Okay. Mr. Santos, can you please let me know how you would like me to address you?
Mr. Santos fine.
Okay, that sounds good. And also, could you please verify your name and your date of birth for me, please?
Rodrigo Santos, August the 2nd, 1977.
Okay, everything checks with your headband. And also, could you please let me know what day is today?
Today is November 25th of 2020, a day before Thanksgiving.
Okay. And where are we?
We are at the hospital.
Okay. And what brings you in today, Mr. Santos?
I'm here for my annual checkup.
Okay, so you came for your annual checkup. Very good. And so I'm going to explain you a little bit what we're going to be doing here now. So we're going to be doing a full assessment of your health, where we're going to spend about 45 minutes together. And first I'm going to assess all your medical history, and I'm going to take your vital signs, and then after we're going to do a head-to-toe assessment to learn a little bit more about you, okay?
Okay.
And at the end, the nurse practitioner will come and she's going to finish the assessment, okay?
All right.
Okay, let's begin then. So, do you have any allergies, Mr. Santos?
No, not that I know of.
Okay, no allergies. And when I mean allergies, it's like about everything, not only medication. Like, do you have any food allergy or environmentally?
No.
Okay, no allergies. And do you take any medications?
No.
Okay.
Just some over-the-counter headache medication.
Okay, over the counter. And what kind do you get?
Excedrin.
Okay. And do you know how many?
I normally take 2.
2 pills, like per day or just
No,
as needed?
As needed, yeah.
As needed. So okay. And do you take any vitamins or herbal supplements?
No.
Okay, no. Okay, Mr. Santos. And so, what about your past medical history? So, do you have any history of diabetes, hypertension,
No.
heart problems?
No.
Okay. Okay, great. And do you have any history of surgery?
No.
Okay. No surgeries. No any like your tonsils taken out or anything like that?
No.
Some people don't count that as surgery, but it's still a surgery. Okay. And how would you say is your mental health?
That's pretty good.
Okay, so
Yes.
you don't have any history of depression or anxiety?
No.
Any suicidal thoughts?
No.
Okay, that's great. And let's dig in a little bit about your family history. So is your mommy and daddy alive and well?
They are alive, yes. Well, my mom, yes. My dad is pretty healthy.
Mm-hmm.
My mom, she has diabetes.
Mm-hmm.
Also, she suffers from COPD.
Okay.
But she's fine.
Yeah, I'm sure this is, so she was a smoker?
She was.
Okay. So yeah, I'm sorry to hear that she's going through all of that. And so your daddy, you said he's pretty healthy.
He's pretty healthy.
Okay,
Yes.
Great. What about do you have any siblings?
I do. Two sisters.
Mm-hmm. Okay, and
Okay.
how is their health?
One is fine.
Mm-hmm.
Is healthy. The other one is it is too, but she is a breast cancer survivor.
Okay, so she had a breast cancer.
Yeah.
And she's they're older, right? You said.
They're older. I'm the youngest.
Okay, and the other sister, she's fine.
Yes.
Okay, and who do you live with?
My wife, my daughter, and 2 cats.
Okay, and so they're all healthy?
Everybody's healthy.
Okay, everybody's okay. And what do you do for a living, Mr. Santos?
I work with cybersecurity.
Okay, cybersecurity. I hear it's a very interesting area.
It is very cool.
Yeah, I think it's kind of like the future security. Okay. So So, and do you smoke or have you ever smoked?
No. No.
Okay, that's good.
Not my thing.
And no vaping or
No. No vaping.
any drugs?
No.
Okay. What about alcohol? Do you drink alcohol?
Yes and no. When like 2, 3 times in a year.
Mm-hmm.
When you have a party, a celebration somewhere, and I take one small beer, that's it.
Okay, so you would say it's very like social.
Not even that.
Uh-huh. Yeah. Okay.
Less
very
than
little. Okay. And do you feel safe where you live, Mr. Santos?
Yes, absolutely.
And at your work or where you live, do you have like contact with pollution or any contact with harsh chemicals?
No.
Okay, that is good. And it's still about your social history. How is your diet? How would you say?
Not so good.
Okay.
No.
Why would you say that?
Because I don't, it's difficult for me to eat many vegetables, and so I eat a lot of fast food. So
Okay.
no good. I know.
Okay. Okay. So, if you would like, before you leave today from your visit, I can give you some information about, because nowadays everybody is like very busy. It's so easy to do fast food, but also there's like like great ideas, like quick meals that you can do, that like to cut a little bit the fast food, because this is really not recommended.
Yeah, I'd like to have this information.
Yeah, I know. At home sometimes we have to do fast food too, but but it's nice that you understand that it's not the best for you. So, okay, how would you say is your health in general?
In general, is good.
Mm-hmm.
Yes, it's good.
Okay.
Could be better.
Do you wanna? Do you have any ideas that you want to implement to make it better?
Maybe eat better,
Mm-hmm.
and feel more. Do a little more of exercise.
Mm-hmm. Okay, yeah. It's nice to again hear that you're open to do more exercising, and you notice that your diet is not the best one. So it's nice when patients come up with that information by themselves, and so it's easier to make the change. And again, we can help you with extra information if you need, and how exercise and diet change can interfere with your health, making it better. Okay. And do you have any symptoms or anything new that you want to discuss with us today?
No. Well, I had some headaches from time to time,
Mm-hmm.
but other than my headaches, everything's good.
Okay.
Nothing else.
So, sorry, I didn't mean to cut you.
No, just that. Nothing bothers me anymore.
Okay.
No more.
I really wanted to learn more about your headache. I'm going to keep asking some questions. I promise I'm not going to forget that. And we're going to touch more in depth. We're going to talk about your headache, okay?
Okay.
Do you have any fatigue?
No.
Okay, no fatigue, okay. And in terms of like your skin, have you noticed any skin discoloration?
No.
Any lesion?
Mm-mm.
Or any itching?
Mm-mm.
Okay, now everything is good with your skin. Do you have any blurry vision?
No.
No blurry visions. Any change in hearing?
No.
No change in hearing. Any bleeding off your gums?
No.
No, okay. And what about your neck? Do you have any neck pain?
No.
No neck pain. Any change like in the range of motion?
No.
Okay.
Everything's good.
And yeah, I see you moving. And also, have you noticed any lumps on your neck as well?
No.
No.
Nothing.
Okay. And do you have any chest pain?
No.
Okay. And any palpitation?
No palpitation. Nothing.
Have you noticed any swelling of your lower limbs?
No.
And I know it's kind of, a lot of questions, but sometimes patients, like, they don't remember something that they even, like, noticed, like, a month ago.
Oh yeah.
And when we ask, we touch that area, and then the patient, like, oh, by the way, now that you asked, I remember. So bear with me with the questions, okay?
Okay.
For your respiratory system, so do you have any shortness of breath?
No.
Or do you feel any pain when you breathe?
No.
Okay, any cough?
No.
Okay. What about your abdomen? Do you feel any pain in your...
No. All good.
Okay. Any nausea or vomiting?
No.
And tell me a little bit about your bowel movement.
That's not so great. I think it could be better.
Mm-hmm.
I normally go to I use the toilet maybe every 2 weeks or
Mm-hmm.
sometimes every 3 weeks. So
Weeks or days?
I mean, I'm sorry. Yes, days.
I was getting very concerned.
Yeah, days.
Uh-huh.
2, sometimes 3 days. I know it's not normal. Most people use the bathroom every day, so
Mm-hmm.
that
Yeah.
concerns me a little bit sometimes.
Yeah, so normally it's optimum. Like, everybody wants to go to the bathroom every day. Some people go more than once.
Mm-hmm.
But if you go like every other day, that's still considering normal.
Mm-hmm.
But I do understand that it's very uncomfortable for people,
Yeah.
And so, based on what you said, that you're not eating too much fruits and vegetables, I would highly recommend you, little by little, try to add them back into your diet because you need the fibers.
Mm-hmm.
So I'm sure there is like much more food options other than fruits and vegetables that can give you the fiber.
Yeah.
But it's really nice if you start to think about that. And again, with the other information that we can provide, exercise, diet, I can give you a brochure about fiber as well if you
Okay.
want.
Yes.
And also you can address that with the nurse practitioner, see if she has more ideas for you, and if she wants to further assess that, okay?
Okay.
And any joint pain?
No.
No
Okay.
joint pain. What about muscle pain?
No.
Any bone like anything wrong with like bone pain or anything?
No.
Okay. Now we're gonna get into the area that I said I'm not gonna forget. We're gonna talk a little bit about your headaches. So, so for what I heard, you have a history of headache. It's not something new.
No, it's not something new. I have suffer from this headaches since I was 8, 9, 10.
Oh wow. Okay.
Since I can remember.
Uh-huh.
And my mom, she has a lot of she always had a lot of headaches and migraines.
Mm-hmm.
My grandmother, and well, I think I have that too.
Okay. And have you ever done anything about that? Like, have you seen a specialist? Have you take?
No.
No. Okay. So it's kind of something that you take. When it happens, you take Excedrin.
Yes.
Okay. Okay. So that's something again that we can talk to the. I'm gonna make notes for the nurse practitioner so she can again address that with you. See if there's anything she can help you with. Like maybe a different medication or maybe a referral for you.
Okay.
Okay.
Thank you.
And do you have any dizziness?
No.
No dizziness.
Well, only when I have my headaches very strong, I kind of feel kind of dizzy.
Okay, they kind of go a little bit together. Okay.
Yes.
Yeah. And do you have any numbness or tingling
No.
in any area of your body? And do you have any sexual transmitted disease? I mean, do you have any history?
No.
Okay. And any changes in urination, like maybe you're urinating more or less?
No.
Okay. And did you notice any blood on your stools?
No.
Okay, no. Okay, great, Mr. Santos. So I think at this point I have got all the information I needed for this first part for your health history. So we're gonna go to the second part, which is your vital signs, okay?
Okay.
Do you have any questions for me?
No.
Okay, so I'm going to start washing my hands one more time. And we're going to start taking your temperature. Okay. Okay, the patient temperature is 97.6. And the normal range for your temperature is 96.4 and 99.1. Anything in between that range is normal, so you're normal, okay?
Okay, thank you.
And now I'm going to take your blood pressure. Okay, 2 fingers. I'm taking the patient blood pressure on the left arm. Just do like this. Okay, so your blood pressure is 110/72. And again, is within the normal limits, okay? The normal range, I should say. So the systolic, it's 120, and the diastolic, it's 80. So yours is 110/72, so it's perfectly fine, okay? So I'm going to take your pulse now. And I need my minutes here. Okay. Okay, so I have your pulse as 85, which is also again with the normal range of 60 and 100. And I also got your respiration rate, which is 14, and is again between the normal range of 12 and 20. And I'm going to ask you now, Mr. Santos, are you in any pain?
No.
So let's say 0 is absolutely no pain, and 10, the worst pain you have ever had. So what would you say is your pain?
0.
Okay, great. That's great. So, Mr. Santos, that concludes our vital signs. Do you have any questions for me?
No.
Okay. So we're going to start with the final part, which is the head to toe assessment, okay?
All
We're
right.
going to start with your head.
Okay.
So we're going to, I'm going to assess your lymphatic nodes. Lymph nodes, so it's going to be preauricular, post-auricular, tonsillar, occipital, submandibular, submental, your anterior cervical, posterior cervical, and your supraclavicular. Okay. Okay, now since I'm here, I'm going to assess your trachea for any distortion. Okay, so any pain or discomfort?
No.
Okay. And again, since I'm on your neck, I'm going to check for your carotid artery, okay?
All right.
So first, actually, I'm going to palpate. Okay, it's a 2 plus. Okay, 2 plus again. And I'm going to listen for it, for any bruits or abnormal sounds. So I'm gonna ask you to take a breathe in and hold, okay?
Okay.
And again. And one more time for this side. Okay, on the other side. Okay, great. So no bruits or any abnormal sounds. I'm going to inspect your eyes, and we're gonna do the cranial nerves now, okay?
Okay.
So first I'm gonna ask you to look up. I'm gonna look at your conjunctiva. It's nice and pink. Your sclera is white, so all nice. And we're going to do this test called confrontation, okay? To test your peripheral vision. So I'm gonna ask you to hold one part, and you're gonna put close your left eyes, and I'm going to do my right eyes. And you're gonna tell me once you see my fingers, okay? I'm gonna get close to you. I apologize. Let me know when you see my
Yep,
fingers.
see.
Okay.
I see. I see.
Okay, let's change eyes.
I see it. Yep. Yep.
Okay, great. Give me the card back. Okay, so now I'm going to check your pupil. Pupils. Okay, mine. I'm gonna shed a light into your eyes, okay? Okay, on the other side. Okay. Now I'm gonna ask you to follow my pen, please. With your eyes only, okay? Okay, now just one more test. Would you please look at my finger and the wall? I'm gonna tell you when to do which, okay? Look at my finger.
Yep.
Look at the wall. Look at my finger. Look at the wall. Okay, so by testing this, we check that the patient has the pupils are equal, round, and react to light and accommodation, okay? So also, we need to make some tests that requires us to check the mouth, but unfortunately, because we're during the pandemic, we're not allowed to take our masks out. So some tests, it's not going to be fully assessed, and some not even assessed, but I will tell what I would be doing at that point, okay? So I'll be testing cranial nerve 5. Would you, your jaw muscles, would you open and close your mouth for me, please? Okay, and we swallow. Okay, and I'm gonna ask you to please close your eyes. And let me know when you feel a touch, okay?
Okay. Yes, and on my forehead. On the other side. My left cheek. My right cheek.
Okay, that's great. And I'm going to ask you to smile. We can't see that. And I'm gonna ask you to frown. We can see that a little bit. And now I'm gonna ask you to puff your cheek with air and don't let me blow it. Okay, great. Okay. Now I'm going to do a whisper test, okay? So I'm gonna ask you to cover your left ears and please let me know what you hear.
1, 2, 3.
Good job. Now we're gonna do the other side.
596.
Yes, perfect. And also at this point, we would be doing cranial nerve 9 and 10, where I was going to ask for the patient to open his mouth and say ah, and I was going to check for his uvula. And also for the mouth in general, we're going to check the tongue, if it was midline, also the teeth, if there's any cavities, the oral health in general. But unfortunately, we cannot do that. And I'm going to ask you to say light, tight, dynamite.
Light, tight, dynamite.
Okay, and now I'm going to ask you to shrug your shoulders for me, please. And don't let me pull it down. Would you do that now towards the front? Okay, don't let me pull it. Okay, great. And could you please look up and down, to the left, to the right? Okay, so that's good. That's good, Mr. Santos. Thank you so much. Now I'm going to ask you, we're going to check your back, okay? So I'm going to ask if you could please remove your shirt.
Sure.
And turn this way. Okay, great. So I'm going to inspect your back. Okay. And I'm going to do an exam called tactile frendus. Every time I touch your back, you say 99 for me, please, okay?
Okay.
Okay, go ahead.
99. 99. 99. 99. 99.
Okay, great. And I'm going to check for your kidney function. Let me know if you feel any pain, okay?
No.
Any pain with that?
No.
Any pain? No. Okay. So now I'm going to percuss. Okay. Okay. And I'm going to listen to your lungs now. I'm just going to ask you to keep breathing in and out for me, please, okay?
Okay.
Okay. So I think we covered everything for your back. And I'm going to ask you if you could please lay down for me. Okay. So I'm going to be inspecting, Mr. Santos, your pericardium. Okay.
Mm-hmm.
And I'm going to be looking for any abnormal pulsations, okay, which none is present, okay? And I'm going to be listening to your lungs again. Take a deep breath, and out, and again. again. And again. And again. Okay, thank you. And now I will be listening to your heart. With the diaphragm. So I'm listening to Mrs. Santos' aortic valve. Listen to his pulmonic valve. Tricuspid. And mitral. And now I'm going to be listening all over again with the bell. You can breathe normally, Mr. Santos. Okay, aortic, pulmonic, tricuspid, and mitral valve. And I'll be inspecting his BMI. Okay, midline. Okay. Okay, that completes the chest exam. And now we're going to be moving to your abdominal area. Okay. So I'm going to inspect the patient abdominal area. So I'm going to, since we're not going to be in your chest anymore, I'm going to cover just to give you some privacy there. Okay, so I'm going to inspect. And so his abdomen is rounded, it's symmetric, and the skin is even and smooth. Okay, now I'm going to auscultate the 4 quadrants. You can breathe normal, okay? Okay, now I'm going to be listening for the aorta and the arteries. Okay, all sound normal.
All
Now
right.
I'm going to percuss. Okay, any pain or discomfort?
No.
Okay, now I'm going to palpate, okay?
Okay.
It's going to be a light palpation. Do you feel any discomfort or any pain while I'm doing this?
No.
Please let me know if you do, okay?
Okay.
Okay. Okay, everything sounds, looks okay and normal at your abdomen as well. So I'm going to cover you like this. And while you're in a supine position, I'm going to inspect your legs as well, okay?
All right.
Your lower limbs. So I see the patient has hair all over his legs. It's symmetric, and the hair is present all over the leg extension. Okay, I'm also checking for edema. Okay, no swell, no edema present. And I'm also checking for the temperature, which is normal. Okay. And I'm going to ask you to pull your feet against my hand and let me move. And the other way now. Okay, thank you, Mr. Santos. And I think I'm going to,
You're welcome.
are you okay?
Yeah.
Okay, so I'm going to ask you to put your shirt back on. We're not going to need that off anymore. And if you could please sit down. And okay, so I'm going to ask you to check some range of motion off your shoulders, okay? So I'm going to ask you to do an external rotation. You're going to do like this, touch your two arms. Can you do that?
Yes.
You touch the two, okay? And now against your head. Okay, great. And I'm going to ask you to please extend and flex your elbows. Okay. Very good. And now we're going to do pronation, supination, pronation, supination. Any pain or discomfort while you're doing that?
No.
Okay, now would you flex your arms for me and pull against me? And the other way. Okay, great. And now your wrists. Could you put your hands like this? And you're going to flex and extend, flex and extend. And then you're going to open your fingers and close, open and close. Okay, now we would need a table to do this properly. So I'm going to ask you to pull your fingers. Yeah,
Okay.
yeah. And now the other way. Okay, great. The other arm, same thing. Okay. Okay, great. I'm going to check your radial pulse. Okay, it's 2+. And I'm going to check your capillary refill. Okay, it's less than 2 seconds. I'm going to ask you to do a quick movement. You're going to touch your leg and do this opposite movement. Yes, as fast as you can. Okay, great. Thank you. And I'm going to give you, I'm going to ask you to close your eyes. I'm going to give you an object. You let me know what that is, okay?
It's a ring.
It's a ring. Muito bem. Good job. And so with your eyes still closed, I'm going to do a light touch test. Let me know where you feel a light touch, okay?
Okay. On my left arm, my right arm, my left hand, my right arm,
Okay.
almost on my fingers, on my left arm.
Okay. Okay, great. So now we're going to test some of your reflexes, okay? So we're gonna try with the triceps. Sorry for my hands are cold. Relax your arm. Okay. Now here. Okay. And again on this side. Okay. Okay, that's nice. And I'm going to do your knee. Does it relax your feet, okay? Okay. Do the other one too. Okay.
Oh.
Good job. And I'm going to do your Achilles reflex. Okay. Okay. And I'm going to wash my hands because I touched the patient's feet. Okay, so I'm gonna test the muscle strength of your hip. Push your legs against my hand. And again. Okay, good job. And your cheeks against my hand. Good job. And again. Yep. Okay. So I'm going to also check for your posterior tibialis pulse.
Oh.
Okay. It's a little bit hard to find, Mr. Santos. But I think I got. Okay, I feel it now. Okay, +2. And your. Okay. Okay, so the lower extremity pulses are +2 and present. And oh. So now, Mr. Santos, I'm gonna ask you if you could please stand up, and you're gonna walk, I think, in that direction. You're going to, you're gonna walk from here to there and come back.
Okay.
Me, please. I'm checking your gait. And come back. Okay. Now can you just do that one more time, but doing heel to toe with your feet.
Like this?
No, like this.
Oh, okay. Oh, I see. Heel to toe.
Okay. Okay, that's cute. You could please sit down again, Mr. Santos. So do you have any questions for me?
No.
Okay. I just want to mention as well that throughout this whole assessment, I checked your skin for any lesion, any new scars, any skin discoloration. I didn't find anything, okay?
All right.
So if you don't have any questions for me at this time, so we're all done with the assessment, and I'm gonna ask the nurse practitioner to come. And please don't forget before you leave to get the brochures with me, okay? With all the information. Thank you so much, Mr. Santos. Bye-bye.
Thank you. Bye-bye.
And this concludes my validation number 3. Thanks so much for watching and happy Thanksgiving.